Okay, hello, my name is Melina Cunha. Today I'll be talking to you about wildfire smoke effects on health, implementing an air quality alert system for UCSD. Quick outline, I'm first going to mention my motivation for pursuing this capstone, introduce you to the alert system I created for UCSD, give you a little bit of background on wildfires and climate change as well as health effects, talk about a few of the other available alert systems I researched, and then go into depth about what I implemented here at UCSD. So, as you probably remember, we had some pretty bad wildfires this past fall season, both in Northern California and Southern California. The Camp Fire pretty much destroyed the town of Paradise, which is where I was born, and the air quality was very adversely affected all around the Bay Area. And as you can see from this map, the air quality index actually surpassed 300 in some areas, which is considered hazardous for human health. So because primary prevention for wildfires, like firefighting activities and debris clearing, doesn't always work, we need some sort of secondary prevention for the protection of human health. And this should really be in the form of an alert system that goes out to everyone who's affected, just telling people about current air quality conditions and what they can do to prevent these health impacts from smoke exposure. And here in San Diego, there is no something called Action Day, which I'll talk about later. The San Diego Air Pollution Control District, they monitor air quality, of course, but they don't have a specific alert system in San Diego. So for that reason, I decided to create one, first focusing on UCSD. I worked with the Emergency Management Division here at UCSD to implement this, and I created 4 different email alert templates that'll be sent out during different air quality levels, as well as a website with more actions to take. Before I go more into this, I want to give you a little bit of background information on wildfires. So there's a lot of different contributing factors that go into wildfires. These are a few of the factors. As we know, in California, we're getting higher temperatures and even more variable precipitation with climate change. This leads to longer droughts and actually a longer fire season in California. So wildfires are increasing in number, intensity, and duration, and are happening pretty much year-round. Wind is another main factor to consider, both for wildfires and smoke dispersion. Santa Ana winds are a type of wind that we get here in Southern California. They are easterly winds that originate from high pressure anomalies over the Great Basin. And they are seasonal, so they happen in the fall and winter time, but they don't really contribute to summer fires. And as I said, the smoke from these wildfires, which usually originate more inland, gets blown to the coastal areas, which are highly populated. So what kind of pollutants are in wildfires? We have particulate matter, carbon monoxide, nitrogen dioxide, ozone, organic compounds, but it can really vary depending on what is burning. Researchers have focused mainly on particulate matter when looking at health effects because these are very small, so they can get deep into your lungs and even into your bloodstream. Smoke inhalation causes exacerbation of respiratory and cardiovascular diseases, including asthma, chronic obstructive pulmonary disease, and even heart attacks. Researchers have also seen some birth effects. So for pregnant women who are exposed during their 2nd and 3rd trimesters, they found that these women actually had low birth weight in their babies. And all of these things can lead to premature mortality as well. It's important to consider vulnerable populations when thinking about health effects from wildfire smoke, because these are people that will be affected first, so we really need to target them first. For wildfire smoke, the most vulnerable include children because their lungs are still developing. They're more active outside, so they're more likely to be breathing in more of the smoke. Elderly because they may have underlying cardiovascular or respiratory diseases. Pregnant women because of the different birth effects I talked about a minute ago. And then anyone with an underlying cardiovascular or respiratory disease is also more vulnerable. So part of my research was looking at available alert systems. Two that I found in California include EPA Air Now and the Bay Area. So Air Now was developed by the Environmental Protection Agency. They have this website called Air Now, which includes an AQI chart, air quality index. They have maps of current and forecasted air quality, a map of current fires, some recommended actions to take for during these wildfire smoke events, and their own alert system called EnviroFlash. The air quality index is a national chart used across the United States. So basically, a raw concentration of a pollutant like ozone or particulate matter is converted to one of these AQI numbers, where a value of 100 corresponds to the national air quality standard. So levels above 100 are considered unhealthy for sensitive groups. Air Now also has an alert system called EnviroFlash, where you can sign up for it with text or email online. And different cities across the United States have something called action days, where they declare when air quality becomes unhealthy. And these are called at different levels based on what the Pollution Control Agency has decided, but it's usually at either code orange, which is an AQI of 101, when air quality is unhealthy for sensitive groups, or at an AQI of 151, when the air quality is unhealthy for everyone. When I signed up for alerts for San Diego, this is the sample email they gave me. There's not really a lot of information on it. Doesn't even have any place for like what the air quality number is, no recommended actions. And since San Diego doesn't have something called action days, it's not even clear whether this would be sent out when air quality did become worse. And I have yet to receive anything from signing up from this. The Bay Area Air Quality Management District also has a pretty comprehensive website about air quality and specifically wildfire smoke. So they have a Spare the Air program, which is analogous to an action day. And they send these types of alerts either when ozone or PM levels are high, just telling residents about it and then giving some recommended actions. And then they are also creating a specific wildfire response plan, mainly because of the large wildfires we've seen recently. So after looking at all of these different action plans that are available, I kind of thought of what I wanted to implement here at UCSD. So I created steps for email messaging and then a website. So first, EH&S, the Emergency Management Department, will be alerted when the AQI passes 100. After this, they will call the San Diego Air Pollution Control District just to confirm this AQI and make sure it's not some sort of anomaly in the data. After this, they will send the initial email alert to the entire campus. So this includes the current AQI, information about the fire, some health impacts, a recommendation to stay indoors, and a link to both Triton Alert and Wildfires and air quality website that I created. The EH&S Emergency Management Division already has emails for everyone on campus, so they're able to send that out without you having to sign up to receive the emails. Depending on whether the air quality worsens a lot or not as much, I have two separate emails that can be sent out. So if air quality does remain above 100, an AQI of 100 for the next couple days, I have an email detailing that and then saying that the campus remains open. If the AQI does worsen to over 200, I recommended canceling classes and closing campus. So there's also a separate email template for that. And finally, when the air quality improves, goes below 100, a final email will be sent out telling everyone that campus activities are back to normal. So I also created a website just to give more information about recommended actions and some health information. So these are screenshots of the website, which is live right now on Blink under emergency preparedness. The top of the website is just a short paragraph introducing people to wildfires and air quality. I included this, I embedded this map into the website. This is from Purple Air, and it shows air quality in San Diego. I chose to use this map instead of the one used on the Air Now, EPA Air Now website, because it's a lot more user-friendly. You can zoom in and out of this map. And there are also a lot more air monitoring stations located through this, this website, and like 4 of them right next to campus. This is also automatically updated, so there's no management needed for the website. Under that, I have some recommended actions to take, both for everyone as well as vulnerable populations. So when levels reach 150, everyone should take these actions, which are staying indoors, limiting outdoor activity, using an air purifier if you have one, and only using a respirator mask if it has been recommended by a physician and you've been properly fitted for it. For vulnerable populations or sensitive groups, these people really need to start taking actions earlier at levels 101. They should also consider relocating to an area with better air quality and seek medical care if needed. I also included a few outside links on the website if you need more information about fire conditions, want more information about different health impacts, and then a link to UCSD Student Health Services. So this, as I said, is available now at UCSD. It should be used during the next big wildfire that impacts campus. And I hope to expand this to the rest of the UC campuses. I want to thank my committee, the emergency department at EHS UCSD, and Eric, who is also part of EHS, who helped me with the website design. Thank you.
Two questions. Did you talk to the county of San Diego? Don't they have a text alert system already for like wildfires or something?
I did speak with them. I spoke to the San Diego Air Pollution Control District, and they said they had no sort of alert or action day system. I don't know if the county has something different for wildfires specifically, but I was talking to like the air quality side.
Could they employ something like your system on the text alert system?
Absolutely.
For you know, just choose a level of air pollution.
Mm-hmm. Yeah, I definitely plan to talk to the county again also to see if they can use this to implement their own alert system as well.
Okay, and then your the PM 2.5 micron mask, is that a good idea for people to have some of those sitting around just in case?
Oh, the masks?
The masks, yeah.
So the masks are a little controversial. If you're not properly fitted, it won't do anything. If there's like a tiny crack, you know, it doesn't really help. So it kind of gives people a false sense of security. And then people with like respiratory diseases might actually have more trouble breathing with them. So that's why I recommend talking to a physician before you use that.
What was the purpose of the indoor air monitor on that map you had?
The purpose of what?
There was an indoor monitor for air quality?
On the Purple Air map? So the Purple Air includes outdoor and indoor monitoring. they show all of their monitors on the maps, so it's possible that the indoor air could also become unhealthy, but most of the monitors they have are outdoors.
So have you looked into how effective the Spare the Air Day program is in the Bay Area? And what kind of impact has that had?
Yeah, so a lot of people during these past wildfires this past fall were complaining that the alerts didn't come out fast enough. So I also thought of maybe in the future using like forecasting for wildfires and smoke. So maybe those alerts could be sent sooner. And then the Bay Area is also, like I said, creating a whole new wildfire response plan. So it's possible that they will be improving on their alerts as well. And it'll be still through Spare the Air alerts, but more specific to wildfire smoke.
I noticed on my iPhone there's an air quality index. How does that relate to the numbers that are
It's the same.
purple air? Okay.
Yeah.
So sometimes it gives me a great idea that it's not a good idea to go outside.
Right. Yeah. So that air quality index is used all across the U.S. So basically, if it's above 100, that means the air is unhealthy for sensitive groups, and that's usually when different alerts are called. Okay, thank you.